50% of those with a history of alcohol abuse can exhibit alcohol withdrawal symptoms when discontinuing or decreasing their alcohol use. Delirium tremens and seizures is the most severe complication of withdrawal. Delirium tremens occurs most often in the first 48 hours after alcohol cessation. It has an anticipated mortality rate of up to 37% without appropriate treatment. According to the NIH, an estimated 88,000 people die from alcohol-related causes annually. Kelly came to the emergency department because she wasn't feeling well. Her last drink was at a Super Bowl party 2 days ago. During triage, her vitals were blood pressure of 147/96, a heart rate of 115, a respiratory rate of 25, a temperature of 99.1, and an SpO2 of 95%. The nurse will do a Ciwa scale to determine the patient's risk for alcohol withdrawal complications. While Nurse Jenny assesses Kelly on the video, we want you to use the Ciwa assessment tool we handed out to also assess Kelly. The Ciwa scale is made up of 10 categories: nausea and vomiting, tremors, which are assessed with the patient extending their arms out in front of them, sweating, anxiety, which can range from mild anxiety to acute panic or delirium, agitation, which is how restless the patient appears to be, tactile disturbances, which can range from tingling in the hands and feet to the sensation of bugs crawling under the skin, auditory disturbances, which can range from mild sensitivity to noise to auditory hallucinations, visual disturbances, which can range from mild light sensitivity to visual hallucinations, headache, and orientation.
Hi, my name is Jenny, and I'm the nurse here. Can I get your name and date of birth, please?
Kelly McGinley, 5877.
Okay. And I understand you're here for some difficulties with withdrawing from alcohol. Is that right?
Yeah, I totally went to a rage around Sunday and I blacked out, and I think I feel so bad. I've been throwing up since I woke up.
All right, so I'm going to ask you some questions, and some of them are going to repeat some things you already told me, but this is to just kind of get an assessment of how you're doing with withdrawing.
Okay.
So, do you feel sick to your stomach, and have you vomited? I know you just told me.
I've been throwing up a lot, and it's not even throw up anymore because I'm empty. It's just dry heaving everywhere, really bad. I might need a bucket.
Okay, well, I can give you this. This will. So.
Okay. Maybe I could use a beer, and a beer would probably make me feel better.
Yeah, I can't get you a beer in here. All right, so when was the last time you vomited?
20 minutes ago, maybe 30.
Okay.
I don't know. Ask your triage check.
Okay. And I need you to put your both hands out in front of you with your fingers out wide. Okay.
Oh, that made me drop my food. Good thing. Okay.
All right. And do you feel nervous?
Yeah. I don't mean, quitting drinking, and I feel like crap, and I feel nervous that I'm gonna feel like crap forever.
Okay.
Plus Pikachu keeps wandering around. Jingle Bells is playing. It's all messed up. It's like a bad acid trip.
Okay. And so tell me more about the Jingle Bells. I'm not hearing them. Are you hearing this all the time or intermittently?
Pretty much in the last couple hours.
Okay.
I've been hearing a lot of Jingle Bells, and it's not Christmas time. I don't think it. No, I'm pretty sure it's not.
Okay. And are these sounds frightening to you?
Mostly just because they're at the wrong time.
Now tell me about other sounds in the room. Are you more aware of them? Are the sounds harsh?
Yeah, I'm normally a pretty loud person, and it hurts me to even listen to myself talk or to listen to you talk. It all just hurts.
Okay. And have you had any itching or pins and needle sensations, burning, numbness, feeling
Not
bugs
really.
crawling
No.
on or under your skin?
No, I don't think so. Maybe. I don't know. Like I said, I blacked out. It could have been, I was numb for hours,
Okay.
maybe days.
All right. So the light in this room, does this appear too bright?
Yeah, that's why I'm wearing sunglasses.
Okay. Is the color different?
The other bad bartender wouldn't let me turn the lights off. What?
So are you seeing colors differently without your sunglasses on?
No, it's just bright.
Okay. So are you seeing things that are disturbing to you, like maybe things that you know are not there?
Only like Pikachu, but it's mostly because I can't find my phone, so I can't catch him.
Okay.
Do you have
so
my phone?
I don't see Pikachu. No, I don't have your
He's
phone.
yellow.
Okay.
He's like a good thing in Pokemon games, I think.
And do you feel threatened by what you're seeing?
No, I'm mostly just getting pissed because you won't get me a beer.
Okay. Yeah, I cannot get you a beer. So does your head feel different? Does it feel like there's a band around your head?
Yeah, it hurts. It just hurts.
All right, so tell me about your pain. Can you rate it on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain ever?
I'd say like an 8 because, you know, when no one's talking, it doesn't hurt as much.
All right, and is it pulsating or is it constant?
It hurts a lot and it goes up with anyone talking. Do you think you could get me drugs if you're not going to get me a beer?
We'll see
Okay.
what the scoring is and what your physician says. So what day is this?
The party was on Sunday, and I think I passed out like for, I don't know, maybe it's Monday. I think it's Monday.
Today is Tuesday.
Well, then I guess I'm wrong.
So do you know where you are?
The place where they do not give you beer.
Okay.
My boyfriend dropped me off at the emergency room because I thought I wanted to quit drinking, but I'm rethinking that right now.
All right, and do you know who I am?
You're the lady who doesn't give me beer. And hopefully the lady who will give me drugs because I think I'm going to have to throw up again soon.
All right, so use this if you need to throw up, and I'm gonna go and talk to the physician. I'll be back soon.
Okay.
All right, so while we are going to go through how we scored Kelly on the Ciwa protocol, while you guys go ahead and just follow along with your worksheet to see how yours compares with ours. So first of all, under the category of nausea and vomiting, notice we scored Kelly out of 5. She said she had been nauseous and throwing up since she woke up this morning. However, she also stated that the last time she vomited was 30 minutes ago, although she was still feeling nauseous. So we went ahead and rated her out of 5. For tremors, notice we rated Kelly out of 5. 4 would be moderate with the patient's arms extended, but as you notice, when Kelly extended her arms, we thought she was a little bit more than moderate. For anxiety, we rated Kelly out of 5. She did state that she was anxious, but we weren't seeing her as acutely panicked. So we went ahead and went with a 5. For agitation, we rated Kelly out of 4 because she was definitely, when you looked at her, moderately fidgety and restless. For paroxysmal sweats, we went ahead and rated Kelly out of 3, although you might not have seen it at home. She did have visible beads of sweat on her forehead, but only at 1 to 2 feet, so we went ahead and put that at a 3. For orientation, we rated Kelly out of 1 since she was kind of unclear as to what day it was, as well as she was a little bit unsure even as whether it was Christmas. She thought not, but maybe it could have been. Okay, so for tactile disturbances, we rated Kelly at a 0. She clearly stated that she was not feeling numbness, tingling in her fingers, in her toes, or felt any bugs crawling under her skin. For auditory disturbances, we rated Kelly out of 3. She was hearing jingle bells, which she knew is not, she thought it wasn't the appropriate time of year for jingle bells, so she thought they were she was a little bit harsh. We felt that was kind of out of 3. And then for visual disturbances, we went ahead and rated her as a 4 for moderate hallucinations because she was seeing Pikachu running around and trying to catch him. However, we didn't feel that that would be a severe hallucination because she was still able to function and know what was going on around her. And then also, for a headache, we rated her at a 5, being severe. She did state that she had a headache, rated it at a pain scale as 8 on a 0 to 10 scale. However, the Ciwa scoring only goes 0 to 7, so we went ahead and gave her 8 out of 10 as a 5 because we felt that would be severe just based on the way she was acting. Then, based on her score actually adds up to 35 if you were adding them up as we went through them. Notice for Ciwa scoring, you're usually going to give a PRN benzodiazepine. The usual choices are diazepam or lorazepam, and these are also going to be specific to the physician treating her. Over here, you'll notice with a total Ciwa score of 8 or higher, you're going to be giving her some PRN meds, and like I said, probably a benzodiazepine. For a Ciwa score of 15 or higher, the physician will also order scheduled medication as well as the PRNs, and again, that's going to be physician ordered, so the physician preference. If the person has a Ciwa score above 35, you're going to reassess every 1 hour and probably transfer them to the ICU where they will be on their medication. Since Kelly was right on a 35, she was on the borderline, so that would be physician ordered whether she went to the ICU or whether she went to the floor. The one last thing we did want to mention about the Ciwa scale is that it does have a high level of subjectivity, which means that as you guys did it at home, and we scored Kelly ourselves, it probably weren't exactly the same, but it does give you a ballpark figure to work with. It also seems to be very good in detox units, but does not work as well for patients that are in more acute or the trauma setting. Also, there have been working on some Ciwa alternatives. One of them involves a phenobarbital titration. One of them is being developed by EbMinds, and they're also working on developing one called an objective alcohol withdrawal scale. It only takes a couple things into account, which is blood pressure, heart rate, tremors, diaphoresis, and agitation.